Hello! Your surgery is now over, and you are preparing to go home with your new nerve catheter. This video will provide you with detailed instructions on how to care for your nerve catheter at home. The numbing medication you received before surgery is different than the medication you were going home with. As a result, you will not be as numb at home as you were at the time of surgery. You will be going home with a nerve catheter attached to a pump that will be used to deliver the numbing medication. This will help you to control your pain and to lower your pain medication needs, but it may not eliminate the need for other pain medications. Okay, let's now hear from the recovery room nurse with detailed instructions on how to care for your nerve catheter.
Hey, Miss Jones. The pump in this bag will be your friend for the next few days while you have the nerve catheter. You want to be sure to make sure you put the strap back on before getting up so you don't accidentally pull out your nerve catheter. So Miss Jones, you want to be careful and make sure you don't tug on the line and that there's no kinking or pinching in your line. All right, now remember, your affected limb is numb, so you want to be careful not to bang or bump your arm. Be aware when you're applying ice or heat, you'll not be able to feel how hot or cold your limb is getting. So be sure to place a towel or some kind of barrier between your skin and the ice or heat to prevent injury. So since you have a block in your arm, you want to make sure you wear your sling at all times. When you're sitting down or laying in a chair, you should keep your arm elevated as you have here. If your block is in your leg, do not use your numb leg to walk or balance or support yourself. You will be given a pair of crutches to help with movement. So you want to make sure you keep your site clean and dry, so no showering, but you can take a sponge bath. You also want to inspect the site every day to look for redness, drainage, or any kind of swelling. The nerve block team will call you daily to check and see how you're doing. If you have any problems like a sudden increase in pain, redness, swelling, or cloudy drainage at the nerve catheter site, please page the nerve block team at 804-828-0951, pager 2899. This is the hospital telepage system. The operator will get your contact information so that they can call you back. If you get a voicemail, hang up and call back and ask them to be paged. If your nerve block issue is limited to the nerve catheter or surgical site pain, again, please page us at 804-828-0951, pager 2899. The nerve block team is better equipped to manage these issues. Okay, so Miss Jones, I've now set the pump as prescribed by the nerve block team. You'll be getting a set amount as well as an extra dose every hour. You're going to hear the pump make a revving sound. That's when you know you're getting that extra dose. Then this is completely normal, so I don't want you to be alarmed. Now that I've set the pump for you, you don't have to adjust the pump. Just remember to carry it everywhere with you and keep it dry. Good. All right, Miss Jones, let's look at this armband that I've placed on your wrist. There's a code on the band that when scanned with a cell phone will provide you with unlimited access to videos on your nerve catheter and troubleshooting information. You will wear the nerve catheter armband for as long as you have the nerve catheter in place.
So I can watch it as many times as I want?
Absolutely.
Awesome, thank you.
After 3 to 4 days, when the pump beeps, reading infusion complete, it is time to remove the catheter. You will need to turn the pump off by pressing and holding the on-off button for 3 seconds. Once the pump is off, you gently peel the dressing back and remove the catheter slowly. You should not meet much resistance. There may be slight leaking once removed. You can apply a Band-Aid. When pulling out your catheter, check for the dark tip to make sure all of it was removed. You will be given a white box with a prepaid label. Please place the pump inside and drop in the mailbox.
Thank you for your careful attention today. Remember, in addition to this video, there is also a pamphlet on caring for your nerve catheter located in the clear sleeve on the outside of your pump bag. At VCU, your comfort, care, and well-being are our main concern. We are always eager to answer all of your questions and to address any concerns that you may have. Please do not hesitate to call us at 804-828-0951, pager number 2899. Thank you.